نسألك يا من هو الله الذي لا إله إلا هو الرحمن الرحيم الملك القدوس السلام المؤمن المهيمن العزيز الجبار المتكبر الخالق البارئ المصور الغفار القهار الوهاب الرزاق الفتاح العليم القابض الباسط الخافض الرافع المعز المذل السميع البصير الحكم العليم اللطيف الخبير العليم العظيم الغفور الشكور العلي الكبير الحفيظ المقيم الحسيب الجليل الكريم الرقيب المجيب الواسع الحكيم الودود المجيد الباعث الشهيد الحق الوكيل القوي المتين الولي الحميد المحسن المبدي والمعين المحيي المميت الحي القيوم الواجد الماجد الواحد الصمد القادر المقتدر المقدم المؤخر الأول الآخر الظاهر الباطن الوالي المتعال البر التواب المنتقم العفو مالك الملك الجلال والإكرام المفسد الجامع الغني المغني المانع نافع النور هادي البديع الباقي الوارث الرشيد الصبور الذي ليس كمثله شيء وهو السميع البصير اللهم صل أفضل الصلاة على أسعد المخلوقات كسيدنا محمد وعلى آله وصحبه وسلم عدد معلوماتك ومداد كلماتك كلما ذكرك ذاكرون وغفل عن ذكره الغافلون.
Let's lead the way, light in the future, share the wisdom to the spirit of Islam. revelation and reason shall prevail. Merging faith and knowledge, we the Khalifa, we will fulfill the Amanah. Together, we make the world a better place forever. And spend the culture of people. Are you there? It's to realize the meaning of Ramadan al-Arabi. Together, we make the world a better place forever. And spend the culture of people. I'm there. Is to realize the meaning of mercy to all worlds, all
Distinguished guests, brothers and sisters, you may now be seated. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya'i wal mursalin. Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Distinguished guests, brothers and sisters, let us begin our podcast today with the recitation of the Ummul Kitab Al-Fatiha. Assalamualaikum warahmatullahi wabarakatuh. Ahlan wa sahlan. Welcome to the Medcy podcast Netflix and Chill. In seeking for the blessings from Allah SWT, let us start this wonderful gathering by the recitation of dua. With that, I would like to call upon Brother Muhammad Harizakwan bin Muhammad Yatimi to recite the dua.
Assalamualaikum warahmatullahi wabarakatuh. إلى هذا النبي المصطفى رسول الله صلى الله عليه وسلم كرام الفاتحة. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Ya Allah, Ya Rahman, Ya Rahim, the most gracious and the most merciful, on this blessed day, in conjunction with our program today, we beseech thee and grateful towards you in favor of all the infinite blessing to us, your humble servant, to live in a safe and prosperous life. We seek your blessing for the flawless progress of this event from the beginning till the end. Ya Allah, Ya Latif, please bless us with your tawfiq and hidayah. Please guide us to greatness, peace, glory and prosperity in this world and the hereafter. Make us a responsible intellectual. Grant us with a valuable knowledge that will be beneficial to mankind in order to gain your mardatillah. Make us your righteous servant that follow your command and neglect the sinful act. Please forgive us for our wrongdoing. Ya Munzil al-Barakah, preserve us from any trick and disaster, neither man-made nor natural disaster. And to you, Ya Rab, we ask for security and prosperity. Be patient in us in order to face the challenge from you. Please accept our deed and please reward us accordingly. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Amin, Amin, Ya Rabbil Alameen. Thank you, Brother Zakwan, for the beautiful dua recitation. Distinguished guests, brothers and sisters, it is with a great honor that I introduce our esteemed speaker for today. Our speaker holds a PhD in pharmacy from the University of Tennessee, a prestigious accomplishment that reflects his deep expertise in the field. He also earned his bachelor's degree in pharmacy from University Science Malaysia, USM, a top institution known for its excellence in the health sciences. In addition to these impressive qualifications, our speaker has also completed a certificate program in global tobacco control from the Johns Hopkins Bloomberg School of Public Health, further showcasing his commitment to public health and advocacy on a global scale. With such a distinguished background, we are fortunate to have him share his knowledge and insights with us today. With that, let us give our warmest welcome to Professor Dr. Muhammad Aniki bin Nik Mohammed to give us his sharing. For your information, our podcasts today are being live broadcast to several schools in Malaysia right now. Please welcome. Ya. Semua gimana nama? Di toilet.
Oh, ni ada?
Okay, boleh.
Testing, testing.
Right.
Boleh ke? Boleh dengar?
Yang ni
Oh,
dia 2-in-1. Sebab kita ada live audience juga.
okey, okey. Boleh.
Baik, start.
Boleh?
Boleh. Right. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
First of all, thank you, Sister MC, our honorable guest, Madam Nurdiana, and also all the participants that have come today. Thank you very much for attending this event. Despite today is a very this week have been very packed for students here, and thank you everyone for coming. Despite next week will be the final exam, but still make your time to come here. Thank you very much.
Thanks.
All right, as we know, the man that sit in front of us right now is an established man. So I think that after hearing about his background, a bit about his background, I think everyone have feel quite intrigued to know more about our professor here. So to begin this conversation, Professor, I would like to ask what sparked your interest to pursue your career in STEM in general?
Okay. Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh.
Waalaikumsalam warahmatullahi.
Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi washabbihi ajmain. Rabbi israh li sadri wa yassir li amri wa hlul min lisani yafqahu qawli. Amma ba'd. So brother moderator, thank you for the question. Madam Nordiana, thank you for the invitation. And to all the students who are here today, I'm very grateful to see you in person. And for those who are joining, I guess live, also thank you for taking your time on a busy Sunday. And as mentioned, you're having your final exam next week, so all the best. And believe me, in relation to the questions asked, it's basically the interest in STEM, particularly science, comes from being inquisitive, asking a lot of questions, having critical mind of many things. In fact, if I may reflect on my journey, it was not always that I was set on becoming a scientist or a pharmacist. My ambition was to become a lawyer or a judge. That was my first interest. I was interested in law, and that probably has a bearing on the fact that I tend to ask a lot of questions or quote unquote argue to some people perspectives that you are arguing, but I guess if you do it in a what you call polite manner, it's not arguing, it's more of a discussion. So as I get older and wiser, hopefully, yeah, tend to be less argumentative, but more of listening and trying to understand perspectives of others. But at the same time, always try to answer the questions that I have in my mind. First and foremost, as a Muslim, of course, and then as a son, as now as a father, as a brother of to my siblings, and now a teacher to my students and friends to others. Um, we probably did not start off having this inquisitive nature, given that I think all of us in this room today are born Muslims. So we're not naturally inquisitive about being a Muslim. So we tend to follow what our parents did or what we learned without much questions. I guess it developed later on that we started to ask questions. Why do we perform salat the way we perform salat? Why do we perform fasting the way we perform it? Not certain other religions fasting where they can still drink or they have certain days only and how a certain time. So we start to ask questions, the open-ended questions, the why, the where, the what, the how, particularly the how and the why. So if you have this nature of asking, despite of what other people say that you're being too inquisitive or you ask too many questions. When I was growing up, my parents labeled me as mulut murai, talkative. Yeah, ask a lot of questions. So maybe that's how I developed the interest in science, because most of the questions were related to life, environment, yeah, human nature. Why certain people act this way? So why people? So a lot of why. So I guess that is the mukaddimah to answer your question. Yeah.
All right, thank you very much, Professor. So I think that we can say that the spark uh, to your love for sciences started from asking a lot of questions. Am I right? So we can say that being curious is important for us in order to pursue this this type of this type of knowledge, this type of field.
Yes. Yes.
So, for my next question, I would like to ask that for all these years of being a STEM student to STEM teachers to a STEM practitioner, what are the most common misconceptions that you have received about STEM in general?
Okay. First, on a personal note, even my two sons, I mean, not really interested in health related sciences, but they're still interested in other fields like aeronautics or certain fields like that. The daughter has an interest in medicine. She's doing SPM soon, inshallah. Please make dua for her. So we, as parents, as in Islam, parents are the ones that color the cloth of their child or children. I don't remember my parents forcing me to do science or technology, engineering, or math or STEM or in general. Of course, the nature of parents way back when is that the most prestigious field that a child can pursue is in medicine. So still is, but maybe that has changed a bit due to certain conditions within and beyond the borders of our countries, the global phenomenon. But it doesn't matter. Like when my daughter, when we asked her what is her interest or what she plans to be or to work in the future, she just said, "I want to be a doctor." So I was like, So, okay, but then we started to discuss the facts. It's not all roses, right? It's a difficult path to study. Is more than other bachelors. You need 5 years at least for the medicine itself, and then you have your housemanship, and then so on and so forth until if you want to pursue specialist level and whatnot. So it takes constant learning. So if you are naturally able to cope with a lot of stress, the work is stressful for sure. All work, I suppose, our jobs are stressful,
Yes.
but the levels may be different, the nature and the types different. So if you have the passion for it, then go for it. Because what I learned is that if you're passionate about the work, it's not really work. Yeah, it's not really something that you feel, oh, this is a job that only gives me salary. But maybe it's something that you feel as a service to humankind, like rahmatan lil alamin, or even beyond human, animals, environment, everything. Because even when you study the Quran, you would know is the ayahs in the surah, even the hadith and the Prophet Muhammad Sallallahu Alaihi Wasallam way of living is highly scientific. The way the Prophet Sallallahu Alaihi Wasallam encouraged questions. Of course, there are certain things that we are not supposed to create. The bid'ah that, but that's a different story. But in terms of understanding why we are here, what we are supposed to do when we are here, how we interact with other humans, with the environment. So people have this misconception that um, the STEM area is more difficult than non-STEM. Um, maybe, maybe to someone who feels this is difficult, it's going to be difficult. But if you feel this is my passion, my interest, as I said, it's not going to be something that going to burden you, right? You feel this is something enjoyable. That's something that you look forward to know more about. So if you have this inquisitiveness, the questions to relate to phenomena that you see and trying to understand it, and hopefully you can understand yourself better and others better, and at the same time get yourself closer to Allah, then it's an ibadah. So people who separate, of course, learning, working with ibadah, I think that's the biggest misconception. And thinking that Islam is not emphasizing on science is also a misconception. It's highly scientific religion. We are only now exploring more and more, right? Islam was the first religion to tell us about nature. Yeah, the things that people cannot even comprehend or even come out with explanations of the cycle of rain, the conception to the development of fetus human and so on, from conception to death, from womb to tomb. It's all explained. So I guess that's the biggest misconception,
Oh.
but there are many other smaller misconceptions. For example, if you do STEM, there's a higher risk of not getting a job,
Oh.
maybe.
Oh.
But the risky is not determined by the employer, right? The ultimate employer, can we say employer, is Allah Subhanahu Wa Taala. If that's written for you, it's yours.
Yes.
Yeah, so don't worry. Just keep on, fighting, I guess, having the resilience, the perseverance, and keep on studying what you're studying, because you are studying STEM, definitely. And then if you see other friends who not taking STEM and your life's more relaxed, yeah, maybe that's their how do I say, particular break at the time. But who knows, later on their work may be more, right? Maybe more. My second son is pursuing law. But even in law, there's STEM. For example, if you are interested in medical legal, so you still have to learn a lot about medical negligence. So you have to understand what's the negligence in medicine that relates to law. So you cannot run away, basically. So vice versa, if you have done medicine, later you feel you want to be the expert in medical legal, then you can take up law. It's a lifelong learning, right?
Yes.
Learning never ends. So even with me, I studied pharmacy, generic, general pharmacy, bachelor. Supposedly can go anywhere. There are many areas of pharmacy, from clinical, where you see them in the wards, attending to patients alongside with physicians, nurses, and other allied health practitioners. They can be in outpatient. They can be outside the clinics or the hospitals. They can also be in enforcement. They can be in regulatory. They can be in research institutions. Of course, you see them in the community, right? You
Yes.
see them in the pharmacies outside. But it means that even in one area of science, you have many branches. So they can even be in what you call that pharmaceutical bureau that deals with administration. They look at laws and regulations governing pharmacy practice. So very different. So who knows? That's generic. Then you can go anywhere. For me, I decided to pursue clinical. Because I experienced a good exposure when I was doing my final year in clinical pharmacy, undergraduate. So I picked up as something that I want to pursue more on. When you learn more deeply about something more specific, then you tend to, meaning that you have more interest in that area. So coming back after my postgraduate, it ended up that yes, I'm still doing clinical, but I turned a bit to my interest in public health. Public health, focusing as mentioned in tobacco control. Yes, there are still medications because my interest is how to treat smokers. Because I was not taught about medications for smoking cessation as an undergraduate. So as I studied more and more, I realized there's this huge gap in the treatment of smokers in our country, particularly. So it became a fardu kifayah. It became a fardu kifayah, maybe even fardu ain, because nobody studied it. That no pharmacist that I know of was giving any medication to smokers. So I realized that is in order to make things happen, you have to learn more about it. So that's why I pursued a certificate in global tobacco control. Um, so the gist of it is that to correct misconceptions, you need knowledge. So you learn more about it, and then you provide the evidence or the solutions. So hopefully that will correct the misconceptions.
Thank you very much, Professor.
Mhm.
So, so I can say that the biggest misconceptions that occur nowadays is that STEM is too difficult. Um, to be honest, I am also a STEM student, and for me, I think I can consider that STEM is difficult, but it is bearable since we have a lot of passion and it is something that we are interested in.
Yes.
So I think we cannot say that STEM is difficult in general because every field has their own difficulty, I think. So it actually depends on each of the person how they would like to handle those difficulties.
Yes.
As for me, I believe that pressure make diamonds, so that a lot of difficulty may come, but it will produce someone who will be better in the future.
Inshallah. Inshallah.
So talking about difficulties, Professor, nowadays we have realized that a lot of younger students does not want to pursue STEM and think that mathematics and sciences are actually way too difficult above their own capacities. So, in your opinion, how can we overcome that problem? How can students, especially, overcome the fear of math and sciences being too difficult for them?
That is the question. We call it a million ringgit worth question, because even the policymakers are confounded with this issue. As I mentioned earlier, parents are the one that determine to a certain extent, lah kan? To a certain extent, the colors of their child or children. So if they are from the beginning, they are exposed to math, for example, or on science, so that in the daily activity of living. So the parents will say, okay, this is 1 ringgit worth of tea. This is 2 ringgit, and then so on and so forth. And when involve the child or the children in math from very early on, from counting, from money, and so forth. So they feel this is something natural, something essential in life, which it is. You cannot run away from counting money. You cannot run away from math in general life. On the other hand, when they go to school, they learn something maybe beyond what they are accustomed or exposed to, like what I've experienced with my children. My daughter studied insurance, discounting, and in maybe if I'm not mistaken, in primary school, and then secondary school it gets more complicated. So yes, there are few ways to look at the issue. One, what we can do as individuals. You are all going, inshallah, yeah, going to be future parents. So inshallah. So what I can say is that make it a way of life. Science, technology, engineering, maths, way of life. And then when they go to school, yes, the syllabus may change, like what we have experienced. They are learning bigger numbers at standard 1 or 2 or 3, and more complex problems than what I learned. So yes, maybe both sides need to relook at the way that we introduce STEM to the students. Maybe at a certain phase, or we are too ambitious, or it's too high. But as I've said, policy makers, they come and they go. They may do certain things. They may change certain things. Um, like if we look at certain countries, they have no examinations until what, standard 3. The first 2 years are just to acclimatize the students to the life of being a student, enjoying social skills. Yeah, how to interact with others, how to make sure your classroom is clean, how to follow instructions, and so on and so forth. So there are ways and means to integrate STEM into the curriculum. Of course, we can always critique, but at the same time, we need to find solutions or propose solutions. In Islam, if we want to correct anything, we do it with our hands, with our mouth, and then we cannot do both of those things. What would you do?
With our heart.
With our heart, make dua. Hopefully, although that's the lowest form of iman, it is still an ikhtiyar. The worst is not doing anything. No dua, no prayer, not writing, not typing anything, not saying anything. So that's the worst, right? So that's amar ma'ruf nahi munkar. So if you put that perspective into teaching STEM to others, so show that you enjoy it first. Yeah, don't make it something scary, or use it to scare others. Like, oh, math is so difficult. If you don't pass maths, then that's the end of your life, or whatever. So parents should never do that to their children. Yeah, we tend to sometimes be over ambitious, kiasu or whatever. Say, oh, see your friend, they can score A in math. You C, you got C. That's you need you need to study. You get A or else. That's the end. You cannot get into good courses and whatnot. No, it's not true. Grades may change. Yeah. Knowledge change. What skills change? So many things. I learned not to burden or pressure my children about their grades. Yes, we want good grades. But if they don't get straight A's, Alhamdulillah, it's okay. As long as they have done their best, they did not purposely make it in such a way that, oh, I'm not interested, so I'm not going to study. What is your amanah? Right now, it's just to study. Just to study and perform your obligatory ibadah. That's it. Yeah. Yes, you may try to find potential partners. Yeah, maybe you want to start early. Whatever is fine, but as long as it's not make you go astray from your main responsibility, just to study. At the same time, you have to make riadah to make sure that you're fit and healthy. So imbue that in yourself. I'm talking about myself also lah. That's why before coming here, I played tennis at Gambang Court. I heard it's very nice court, so I came early, around 8:30 to play tennis with one of the students here, and also your director, brother Daniel. And I brought along my son. So riadah for ibadah. Because you have to be fit, you have to in order to study. So that's why Islam is shumul, is complete. It has this balance. It wants you to make sure that you strive for the best, as if you're going to live, is it forever? No, for 100 years. But remember, do your ibadah as if you're going to die tomorrow. Okay.
All right, thank you very much, Professor. So as a STEM student and a STEM teacher yourself right now, um, what are the have you ever faced any challenges or failures while pursuing this career? And if there is any challenges, how do you overcome it? And how can you remain the same spot that you have for STEM?
A lot of failures, a lot of disasters, a lot of misses, a lot of how do I don't know, but it's a matter of perspective. So if I get knocked down, I just get back up. So just learn your mistakes. For example, last minute studying, not looking at the exam schedule properly, thinking, oh, tomorrow is exam. I haven't studied this paper. Okay, that happened. But anyway, um, you learn from your mistakes and make sure you don't repeat. Yeah, find the hikmah in everything. Of course, all the tips about positive thinking, husnuzon, qana'ah, that you are satisfied with whatever happens, and always striving to have the ihsan for others. Don't just think about yourself. Teaching others is a very good method to know that you know or don't know. So always share. Don't think that you got certain knowledge and you keep it to yourself. No, I guess that's why I'm a teacher, because I like to share. So um, there are too many to mention, brother, but
One or two
you one or
examples.
two example. I already mentioned. I wrongly look at the timetable. That happened. Wrongly answered questions happened. Yeah, almost failed happened. Yeah, but the thing is that what kept me going is, again, I know first and foremost is my amanah to study. So if I sleep, it's okay. I'm a human being. I'm not perfect, but learn from it. Learn from it. What happened? So don't repeat your mistakes. So if it happened, it happened. So just analyze the situation. Next time, if you cannot cope with the pressures, get help. So similarly, remember that if you have good companions, good friends, yeah, just like the Prophet Muhammad SAW said, even if you good friends are like perfume, right? Even if you don't wear it, if your good friend is like a perfume, you also have good fragrance. You also smell good. So find good friends, and alhamdulillah, all the students in IIUM, they are good friends to each other, inshallah. So we can always strive to be better. Similarly, in our daily activity of living, we always strive to be better. We're not perfect. We're always imperfect, but we strive to be better. So I guess that's the short answer or the easy answer to your question. When you have mistakes, you have done mistakes or any failures. I don't like the word failures. It's not these are learning points. They are learning points. Yeah, it happens because Allah Subhanahu wa Taala wants you to learn. So sit back and analyze and think why it happened, and then try to improve on it. You will have, I'm sure, a lot of opportunities to improve. Yeah, I'm already 55. So if we go by nature, my time was what 8 7 8 years. That's it. So little left. Yeah, but you have a long way to go. So you have many opportunities to improve. Inshallah.
Okay, thank you, Professor.
Mm.
So we can still say that as students, we need to always, we first of all, we need to realize that our failures are not actually failures. It's
Mm.
actually learning points or learning curve that
Mm.
we need to analyze and that we need to relearn so that we can avoid those mistakes, so that
Mm.
we can strive to be better in the future.
Inshallah. And your successes
Mm-mm.
are indeed successes, but also learning points
Mm.
to hopefully remind you that these are rewards for you from Allah and to benefit others.
Ah.
And remember always to remain humble,
Mm.
because our knowledge is just a drop in the ocean.
Mm.
So
So as students, we need to always learn, despite of having failures or having any successes,
not
the
failures. Yeah,
mistakes or
yeah,
learning
learning
points.
points, learning points.
And
Yeah.
even after we have reached success, we still have not reached the peak, or we haven't learned everything that we can learn.
Mm,
We still need to strive to learn more and more each and every day.
true.
So, Professor, since for your information, right now from the live audience, from
Mm,
the live stream,
mm,
there are actually students from high school that we have
mm.
invited to attend this live.
Wonderful.
So,
Mm.
um, from
Which high school?
there are a few high schools from
Okay.
MISM. There are
Oh.
quite a lot
Mm,
actually.
mm,
So, to those students, because mostly all of mostly those students that attend this live stream, actually students that haven't decide where they want to go or which field that they want to pursue.
mm,
So, to help the students, how can you decide or how can you choose your future career or future field if you are not decided right now?
Okay. Another 1 million ringgit question. As I've said, your risk is already determined by Allah
Mm.
Subhanahu Wa Taala. What we do now is to hopefully
Mm.
align with that
Risk.
decision
Mm.
or fate, yeah,
Mm.
bestowed upon us. So yes, when you are in the MRSM,
Mm.
Mata Rendah Science, the word
Mm.
science is there. So you have already the passion, the interest. If you join MRSM and found out I don't like science,
Mm.
it's fine.
Mm.
It's fine. But because you are brilliant students, they are brilliant. Of course,
Mm.
to be able to join MRSM, they are brilliant students. Why I say that? I'm a product of MRSM. Bursary Perlis, Pioneer Batch. So but just if if they and other students join other schools, they're also brilliant.
Mm.
So in essence, everybody's brilliant. We are given by Allah Subhanahu Wa Taala akal, yeah, that has almost unlimited capacity. It's limited, but in terms of learning, we can learn so much, right?
Mm.
So whether you are in MRSM, non-MRSM, it doesn't matter.
Mm.
You're all brilliant, yeah. Regardless of any universities, they're all brilliant. It's just that opportunities available and fate by Allah Subhanahu wa Taala. What has been decided, kun fayakun. If it happen,
Mm.
it will happen. So
Mm.
don't worry. If you're in MRSM and then you found out later on that you're not really into STEM
Mm.
fields, it's okay. The, you still have many
Other careers.
opportunities along the way to go into maybe more non-STEM related
Mm.
areas.
Mm.
But as I've said very earlier on,
Mm.
STEM is a way of life.
Yes.
You cannot run away from it. There will still be maths, there will still be
Science.
chemistry, uh, ex- like my daughter, like we see, especially what you call natural phenomenon, be it like in the sky, meteor, calamities, disasters. So it takes a lot of science to explain these occurrences. Yeah. So that has been the way that we want to understand and explain life. So even when you graduated or finished MRSM, SPM, everything, you go into non-STEM, it's okay. It's okay. You can still choose non-STEM courses for your university. It's okay. The main thing is your interest and your passion. Why I say you have to have the passion. If you don't have the passion, it's very burdensome. Yes, the pressure will make diamond, but what kind of diamond? The what is it? A 4C diamond, a 4 carat diamonds, or the low quality diamonds? Yeah, you'll become diamonds, but diamonds in the rough. Still useful, still diamond. You all end up as diamond. We have different level of pressure that we are exposed to. We become different types of diamonds. Okay, but it's still a diamond. The that's something that you cannot run away from. Pressure of life. So you need to the skill to cope with pressure. So if you cannot handle it yourself, seek help. Yeah, seek help from. That's why you need to have good friends, and you have mentors, you have lecturers, you have counselors, and beyond. Yeah, sometimes the problem is organic, like psychiatric disorders. It can be organic. There's something imbalance in the chemicals. So you need to understand STEM lah in order to explain why this disease lack of certain neurotransmitters and would result in depression, imbalance of dopamine, schizophrenia, imbalance of GABA would cause anxiety. So you need to understand the differences in the chemical structure of the neurotransmitters that interact with different receptors. Then that result in different kind of disorders. And similarly, from the pharmacist perspective, how do you come out with drugs that would then help to mimic the neurotransmitters and then stimulate the receptors to produce the neurotransmitters needed to address the different psychiatric disorders. That's just one example. There's so many diseases, right? So we need to come up with so many different chemical structures. So chemistry is important for pharmacy. If you're interested to develop drugs or to make new molecules or to explain or to help people understand how we manage disorders or diseases. Okay, so going back to the question, if you have the passion, alhamdulillah. If you don't have the passion, you can still find ways to change. It's just a matter of perspective and the amount of STEM related to the course. So if you take, for example, human sciences, yeah, or you take Arabic, I'm sure there's still STEM in it. Yeah, but it's not going to be as much as if I take pharmacy, of course. But having said that, there will always be STEM in various forms and shapes in our life. And maybe if we are not emphasizing on STEM as our career, but maybe our children will. So don't dismiss STEM totally. Don't be afraid of it. If I say it's just a subject or group of subjects, right? So, but it's just another knowledge area. Some people perceive it as difficult, but so many people manage to be an expert in it. Madam here, expert in chemistry. You can interview her and say what made her want to learn chemistry and pursue at a higher level and become an expert in chemistry and teach others about chemistry. That is a very difficult subject, even for a pharmacist. I would say when I was learning pharmacy, chemistry is the most difficult because they have different types. They have organic chemistry, non-organic, pharmaceutical chemistry, many types of chemistry. But now, when we practice, we understand why we learn all those different types of chemistry. I would say that the joy of learning comes when you understand how it is applied or how it relates to your daily living, or your profession. If you see that interrelationship, then it makes it very interesting. If you see it as a dry content, I learn chemistry PKA, PK whatever, and then this is the mole and the molar, and then that's it. But you have to go beyond. How is this applied? When you see application, then you'll be more interested, I'm sure, right? So always ask that question, how is this applied in real life?
So, meaning to say, for those students who are still undecided about which field they want to pursue, we can say that it is not important which field that they want to choose, but as long as it aligns with your interests or your passions, you can go for it, and still you cannot dismiss other fields that you may not like or dislike, as it will every knowledge that you seek will be used in your daily life.
Yes, ibadah. Another example is my MA. I learned a lot of STEM-related subjects all this while. But as I said just now, my interest changed into public health, into helping smokers to quit. I thought that, okay, if I learn the medication, if I give medication, everybody will stop smoking. Did that happen? Of course not. First, I need to make sure that the patient understands about the medication. To get people to understand it's not easy, especially why do you have to take the medication? And that why of human behavior, the taking of medication is related to human behavior. That is psychology. I didn't learn psychology. Do I need to learn psychology? Yes. If I want to be a better pharmacist. So it's totally different field. And there are so many models about human behavior. I can share with you some of them. For example, the model that talks about transtheoretical model of behavior change, that puts behavior into different stages. If I ask you, do you have a behavior that you want to change? Yes.
Absolutely.
Yeah, absolutely. Thank you for your honesty. We all have one. Yeah? For example, for me, I want to eat less cheesecake. Has that happened? No. Yesterday or the day one. But anyway, that's the behavior that I say I want to eat less dessert, exercise more. For example, that's very common. But at what stage am I about changing my behavior? Similarly with medication taking or smoking cessation or doing something. Are you in the pre-contemplation stage? What is that? It means that in temporal relationship with time, you are not thinking about the change of behavior at all. You say, yeah, I may want to exercise more, but I don't know when. Okay, that's pre-contemplation. But if you're in contemplation, you're talking about Yes, maybe in about 3 to 6 months, I would do something to change this behavior. If you're in preparation, it's 1 month. I say I have 1 month to change this behavior. If you in action, then you're already changing it. For example, you say, okay, I started brisk walking. Or whatever. Then, if you in maintenance, of preparation or action, then maintenance. You sustain that change for a certain amount of time. For smoking cessation, the amount of time is 6 months. At least lah, we want it forever, but then you have to understand another thing. Disease. Tobacco use disorder is a disease of chronic relapsing addictive fashion. So it is long term and it's relapsing. Do you understand relapsing? It recurs. You stop, you relapse, you do it again, then you stop again, then you stop and you smoke again. So it's part of the disease. Understanding that would help the provider not to blame the patient for relapse. So that I didn't learn during pharmacy because I learned about drugs. I learned drugs, mostly drugs. Now human behavior come into the picture. You have to understand human behavior to a certain nature. So my counseling, medication counseling changed. There's also a technique called motivational interviewing that I didn't learn as a student, both undergrad and postgrad. So what I'm trying to tell you, learning is never ending. It's lifelong. Yeah? Drop in the ocean. But what's the purpose of learning? You want to be the person, the best person is the one that gives benefit to others. So you want to give benefit to others in whatever you do. So if I can help one person to quit smoking, inshallah, the benefit is not only on that person, but the surrounding person or people. It can be his wife, it can be his children, it can be his co-workers, it can be his Qaryah, Surah or Masjid or a community. Because you understand, second-hand smoke kills. Second-hand smoke that's inhaled by non-smokers can cause premature death and diseases. So I try to make as much ibadah, good deeds as possible in my work. So we run clinics. We run quit smoking clinics. Yesterday I was at Kuantan Menara 188 having a booth promoting smoking cessation. Okay. Before that it was in IIUM Masjid. So people ask me, why do you still do this kind of work, going on taking the weekends, going to schools, going to the public, talking about vaping and smoking harms and how to quit smoking and vaping? I said, this is my ibadah. I try to collect good deeds as much as possible beyond the 4 rooms of my lecture halls or going to the hospitals and whatnot. Yeah? And when you explain to people, it has to be science. For example, we did carbon monoxide breath analyzer testing. You know carbon monoxide?
Yeah.
What's the effect?
It has to disturb the oxygen production.
Exactly. Because our red blood cells, applause to him. If you don't have that knowledge, then you can explain to the patient and they should understand what the importance of carbon monoxide. So you're trying to tell the smokers, when we measure, oh, this is too high. You have 20 parts per million of carbon monoxide in your system, in your blood. So it means that your cells are deprived of oxygen. And what does the effect? Damage to the cell. Enough damage to the cell would cause damage to the tissue. Enough damage to the tissue, damage to the organs. Enough damage to the organs, to the body. What are these organs sensitive to oxygen? Lungs, brain, heart, kidneys, for the men, genitals. If not, you have erectile dysfunction. For the women, you have infertility. So, by explaining through science, people understand the importance or the dangers of certain things that hopefully would motivate. Of course, all what we're doing is to motivate. Hidayah is from Allah Subhanahu Wa Taala. It's not from me or my colleagues that make somebody quit smoking. It's the hidayah. But to get the hidayah, they have to do certain things. They suddenly came to the booth. They suddenly tried to do the carbon monoxide analyzer. They suddenly talked to us about dangers of carbon monoxide. Then we talk about all the heavy metals, the plumbers, the cadmium, the arsenic, the chemicals. Why are these chemicals dangerous? The formaldehyde. How they relate to cancer? So chemistry applied to health. Then you motivate in order to change behavior. Learning for the sake of ibadah should be very motivational because you have in mind, you learn chemistry, you learn physics, you learn math, you learn what else? Biology, very important, yeah, for medicine, pharmacy, everything, like that. In order to transform them into ibadah. If you have that in mind, these are not burden. Yeah? It's something that you look forward to learn because you're going to help others. You're going to be the umatan wasata and then also the best of humankind that gives benefits to others. Inshallah.
Thank you very much, Prof. So let's say that if we have, as a student, have decided to pursue our career in STEM field, and right now we are studying. So while we are studying, what are the best skills, the most important skills that we need to have or we need to prepare before we step our foot to pursue the career of STEM?
Oh, you want to pursue career in STEM? Yes. From the beginning, if you have not applied your knowledge, then when you step out, that's the opportunity. But it's missed opportunity. What's better is that when you are learning, try to relate it to the work that you want to do. If you learn this, you say, how does this relate to being a doctor, being a pharmacist, being an ophthalmologist, being an optometrist, being whatever. Yeah? Being a biologist, environmentalist, I don't know. What you end up, Allah Alam kan? Tapi, whatever it is, try to relate it from now and think of the impact that you're going to make on others as well as yourself. So, in order to do that, when you go out, realize that your knowledge may be outdated. Because certain elements in STEM, they change. Right? People say there are not many things that remain constant in life. For example, aging, death, and taxes. You have to pay tax. You will age, you will die, and you will pay tax. Otherwise, everything else is unsure. We cannot say for sure. So say inshallah, but it's always like that. So by the time I finish my whatever session today, some of the things I said is already outdated because new evidence comes in, and in the field of STEM, you cannot avoid that. So be prepared of changing your understanding, accepting new evidence, new knowledge. Always see it or use the Islamic perspective as your background So is it in tandem with Islamic perspective, this new knowledge? If it's yes, embrace it. Right? If it was, no. People say, oh no, what you learn about carbon monoxide has changed. We say, in what way? In what way has it changed? If it's still carbon monoxide, if it's plumber that and formaldehyde and still cadmium and nickel in apa tu electronic cigarettes, with cholesterol, propylene glycol, everything is still dangerous. It's still dangerous when you finish your study. But believe me, you have to be flexible because, especially in area of health, many studies are done, and that would impact practice. If I take an example, beta blockers. Have you learned any drugs at all? No, not yet, right?
Not yet.
Okay. Beta blockers are a group of drugs that can lower blood pressure, especially by affecting the heart rate, reducing the heart rate. So this is a bit of biology. But chemistry-wise, there are different types of beta blocker. As they interact with the receptors that govern the heart rate and also vascular resistance. So as you learn biology, there's alpha receptor, beta, different type, beta 1, beta 2, and so forth. So interaction of chemicals with different receptors give rise to different effect. Okay. So having said that, one of the management of hypertension is to give beta blockers. However, certain patients develop adverse effects or side effects. There are differences, but let me say increased risk of diabetes. So unfavorable for people having diabetes already at risk. But they are life-saving for people post-heart attack or having heart failure. This is my knowledge. Certain older lecturers, during their time, they were told beta blockers are not indicated for post-heart attack. It increases death. Yes, based on studies, that happened. But during my time, they use different beta blockers that are more specific, and they use different doses. So beta blockers are indicated. Now, in 2024, they are studying it again, and they say it's okay to not give beta blockers post heart attack. So things change. What you learn during your foundation, bachelor, and then maybe beyond may not be true all the time because the highest hierarchy of knowledge starts with Quran. Of course, you're not going to find beta blockers in the Quran, yeah. But the pursuit of knowledge, the general, the science part of it of human beings is there. But what I'm saying is, since we don't have anything that specific in the Quran, we look at systematic reviews and meta-analysis of randomized control trials. This is clinical. I'm talking about clinical. Meaning that, what am I trying to say? In Allah we trust, in others we need data.
Nice.
So if you have this mantra, you will have this inquisitive mindset, saying that, where do you get this data from? What you say is true, but it's based on the study or the data that you obtain. Of course, there are flaws with studies. So you have to critique the study pula, thinking that if there are flaws, are they major flaws, or what you call discrepancies or inadequacies that would make the study go lower down the hierarchy of knowledge. The lowest form of knowledge is expert opinion. It's still knowledge, but it's the lowest form. For example, a specialist say, this is the way I treat this disease in my practice. It's still knowledge. It works. The way that he or she practices using something, that's still knowledge. We still respect that, but we consider it as the lowest form of knowledge. So when you in Islam, we are asked to tabayun. So check the source, who said it, how the data is obtained, what is the conclusion correct, is it going to be more beneficial than harm, then only you share. Yeah, bukan tibayun. Don't mind tibai. Yeah, tibai hayun. No, that's not the way. That's not Islamic. We want to tabayun. Okay.
So, Professor, as a student or as someone who would like to pursue this career in STEM field, it is important for us to always adapt with time and adapt with whatever knowledge that may improvise or may have come in the future.
Yes.
But it is also important for us to filter those knowledge by using our own knowledge and by taking it from different perspective.
Correct.
So, Professor, since I am sure there are some students here that are quite intrigued to pursue their careers in STEM field, but some of them may not know yet which career or what career would they like to take or would they want to pursue in the future. So, in your opinion, Professor, what are some exciting STEM field careers that may students not know for now, which considered as unpopular or not very popularized by our culture that is still in need in today's world.
Okay. In terms of workforce here, health is always in demand. You cannot run away. People, as I said, aging and die. In between, they get sick. Right? As we age, we get diseases. As maybe test tribulations from Allah Subhanahu Wa Taala to make sure that we are grateful and also maybe kafara and whatnot. But anyway, so it means that because that one is absolute. Will age, will die. So in between, we get sick. Of course, some people from birth till death, 100% fit and healthy. Yes, but majority no. Maybe the levels will be different. Severity is different. Light, moderate, severe. Some people are tested with just plain simple headaches. Take paracetamol, gone. Ikhtiar, right? But some people tested with lung cancer. So medication, maybe also surgery, and also maybe radiotherapy, many things have to endure. So that's also a test from Allah Subhanahu Wa Taala so that we become grateful servants. If we take that from that perspective, whatever comes is okay. It's from Allah Subhanahu Wa Taala. But we have to be grateful. At the same time, we have to ikhtiar. We have to try. So if you want to pursue in the field of health, it's very vast. Vast field of health. And within health itself, there are always new areas. What I can say now is the maybe intermarriage of areas. It's not just one area anymore that people are needing. Yeah, a lot of development now in AI. So AI impacts health a lot. Yeah, and some predictive models are used or to facilitate treatment based on what we call precision medicine. How do we get precise? Because each one is created in a unique fashion. Yeah, even our thumbprint, different. Even for twins, they are different. So knowing the uniqueness that's created by Allah Subhanahu Wa Taala, it means that specific genes, specific responses to chemicals or drugs or maneuvers or maybe uh, exposures would result in different results. I cannot just assume all of you have the same genetic makeup. Definitely a wrong assumption. Yeah? Why? Different genetic makeup would give rise to different responses to medications. Why some people need higher dose, why some people need lower dose of medication. One good explanation is because they have different rate of drug metabolism. What governs drug metabolism? Most commonly, the liver enzymes. There are so many families of liver enzymes. So, just like us, the family may have different members. Some have many, some have few. Those with many family members tend to be able to metabolize the drugs or the substrate faster. Therefore, they need more of the drug, or the schedule of dosing is more frequent. So we tailor it to your genetic makeup. But to do precision medicine is expensive for now. Because you have to what we call genotype. We have to genotype of the gene of interest. How do you express certain genes and how that reacts to treatment. So unless we have unlimited financial resources, which is never going to happen, so AI is the way to predict. How they predict it? Maybe they use certain algorithm so that we can tailor the medicine to you. Everybody should get precision medicine. So your knowledge in later on treatment includes also maybe knowledge on AI, knowledge on pharmacogenetics, yeah, so that hopefully if you're into healthcare, people can get the best treatment as an individual and not as a group for per se. Yeah. So with the advent of AI, I think more and more overlapping between healthcare and IT, particularly, would come into play. So yes, you may have certain interest in STEM, but expose yourself to other areas. Of course, we cannot learn everything. Some people may be experts in AI. Then you merge your knowledge and work together so that at the end, who's going to benefit? The patients. The patient is going to benefit. So we don't know what's going to occur in the future, but one of the occurrences was pandemic, disasters, virus born. We had many before, Ebola or MERS-CoV, yeah, H1N1, bird flu, and latest this COVID-19. We don't know what's going to happen in the future, but people predict there are going to be more because virus mutate. They can change. They can be created. They can then be spread easily, contagious. We don't know. So, pharmacy, antiviral. That's going to be effective. That's how one of the drugs produced other than vaccines. Vaccines, of course. Why? Because we want to start to get herd immunity to produce antibody, and everybody would at least 80%, for example. If we get 100%, alhamdulillah, to be protected. But it will come again. For sure, all these new diseases, so virology will come into play. Vaccine production will come into play. And then, if we can prevent, that's ultimate. Because right now, we're talking about mostly curative, but we need to look more into preventive. So maybe to answer your question, what are the preventive measures related to STEM that you can go deeper into so that it will have impact on life? Health, there are so many determinants of health. That individual or population is only just one. You have social determinants. I mentioned just now, human behavior, understanding that, changing that. Wouldn't it be great if you have a chip and then you just install, everybody would be adherent. They would follow the medication taking regimen. If I ask here, how many of you have been fully compliant to taking the medications? Can you put up your hand? Fully compliant. You never miss a dose, it's on time and complete regimen. If you're taking antibiotic 3 times a day for 5 days, you don't miss any medication at all. Yes? Put up your hand.
Open now.
Menipu ke menipu guys?
Aku dah.
Do you see my hand going up? No, also, right? Even as a pharmacist, I'm not compliant.
Yes.
Even worse, pharmacists are the worst. Alamak, buat ni ke? Side effect tak nak ambil. But, what is the use, what the benefit that is going to occur if patients do not take medication? Of course, you can make doa, like I said, right? But no is here. So, no point. So, you have to also change that. If you have a chip that goes into somebody's brain, turn him or her into a compliant individual, that would be the easiest. You feel anything, it will be taken correctly. It doesn't occur. But you need to look into social determinants, personal, economic. Economic determinant is so important. Some people have difficulties to obtain treatment. So, if you instead, you think of how do I make access of medication? How do I make people get access to information? Because there's a disinformation, a lot of misinformation everywhere because of social media, internet, everything. So, to correct this, maybe your area is not really STEM, but is on correcting myth and misconception, and then it's like education, but using the social media platform. Yeah, instead of TikTokers talking about divorce or artists, you go into the content that talks about health. So how to make it interesting, appealing to people, that's another area. Okay, don't forget environmental impact on health. Some diseases are related to calamities, disasters, post-flood. We are experiencing it now, flooding in several states. Flood, expected or recurring flood.
Bawalah sikit.
In one time yesterday,
Terima kasih.
the shop lot, shop lot burned down. So I saw the smoke coming out from the Bedara 188. I was there and I said,
Rendah lagi ke? Sama je tinggi dia.
Initially because it just rained before and I thought it was rain cloud, but
Rendah lagi.
smoke cloud. Yeah, smoke cloud. So that is pollution. Definitely environmental pollution. And the burning of chemicals in the materials that burn, where did it go? Yeah, it will end up in the environment. It will end up in the air. It rains, it goes back into the soil, it goes into the water system. Malaysia has been reported as the one of the countries, if not the main country, where the people consuming microplastics. So imagine what happens if plastics go into your system. So there are also impact of environment on health. So that is them. And people who study math, they are very good at create, creating models that predict certain changes over time. They can use equations, right? Algorithms and whatnot to show you if this continues, what the trajectory over time. What would change, what would happen, what would impact. And they can have multiple confounders. And they can input that and then come out and say, yes, in 20 years' time, Malaysians will have this kind of diseases related to consuming microplastics. So what I'm saying is that, yes, you learn STEM and you can go into certain niche area. Lifelong learning comes in, you can take further degree. If it's new, then it's qualified. Just like I said, if you found out, yeah, nobody is talking about it, nobody is learning it. So you have to start somewhere and get like-minded individuals to think on how do we create something that hopefully would prevent, because prevention is better than cure. Okay, that's also very something. Curative is very expensive, and we don't have the resources to keep treating diseases.
Thank you very much, Professor. So interestingly, it's actually related to our root discussion just now, which we cannot stop learning, despite have chosen a certain path to pursue career in STEM. We still need to learn other fields and also other practices that we can combine to lastly to give benefits to other human beings in our communities. So before we proceed to Q&A session, I would like to ask Prof.
but do ibadah actually going to die tomorrow. The ibadah you can kill people, and death has occurred. If you're a doctor, you wrongly cut someone, you can kill somebody. Wrongly diagnosed, wrongly treat, you can do anything after you cut. Na'udzubillah, that's not our intention. In order to prevent that, you got to have the knowledge and skills, right? That would minimize the errors. So, STEM is very evidence-based, and what we want is for you to always to have that level. Not everybody is having the opportunity, but there are people who study the Quran inside out, and then you can then have a discussion with those supposedly more knowledgeable people about what you study and your knowledge and how it relates to what is said in the Quran. Where is it? If you don't have it explicitly, maybe implicit. If not, nobody can tell you, oh, this is not, this is in the Quran, or okay? Then look at the level of evidence.
So right now, I may pass the floor to anyone or pass the mic to anyone that would like to ask question regarding STEM directly to Professor. So please welcome.
One of, as I mentioned just now, one of the ways to gain knowledge is to start by asking. Right. So you have to ask.
My name is Fadi Somaisara and I'm from Underhead Science course in CFS. So I want to ask you about the PT3. As we all know that PT3 is now being removed. So with the removal of PT3, which is used to guide us to the screen process and assess students based on their interest and strength. So about the removal of PT3, my students now move directly toward preparing for SPM. Given this change, how can we sustain or even increase student interest in choosing the science stream, especially when the early indicators of performance are not longer available? What trend do you foresee emerging from the new approach, and how might it impact students' choices or the overall perception of science subject in the future?
Okay, thank you, sister. About removal of PT3. First and foremost, note that there are many ways of assessment. Yeah, when you become a teacher, a lecturer, you will see that pen and paper exam is just one of the ways. So don't get bogged down about changing methods of assessment. There are many methods of assessment. It can be assessed, the knowledge and skills can be assessed through different ways. Yeah. So it can be more emphasis on communication skills and how they present the knowledge, gain the knowledge, and then present. Problem solving skills can be on creative skills, can be what they can produce, can be multimedia, can be projects, can be so many things. So to me, change in method of assessment is not a big deal, as long as the core learning business is there. Like what we do in our university, we can change method of assessment, but it needs to be aligned with the what we call constructive alignment with the learning outcomes. So at certain years, you have different learning outcomes, right? In certain subject, you have certain course or subject, they have their learning outcome. They all go back to the program learning outcome, the big one, okay? So, methods of assessment, no issue. Yeah? You can abolish PT3 pen and paper, but you have different modes of assessment that will sustain the intention of imbuing the students with the knowledge and skills, particularly knowledge, some skills, in STEM. To me, no issue. Policymakers come and go, but then we have what we call the Dasar Pendidikan Kebangsaan, the National Education Philosophy. That has not changed. So as long as it is aligned, method of assessment can change. We don't want to be so exam oriented. You learn because of exams. Yeah. As I said, what's the purpose of learning? Ibadah. So if we can have that in all our students, Alhamdulillah. But not yet. The thing is that people always say, you have to learn this, you're going to come out in exam. You learn this because you'll be tested on this. Yes, to a certain extent it's true. And we need to have a measurable evidence that you know certain things. But knowing certain things have different level of hierarchy. Yeah? Know as in comprehension. Yeah? It's the lowest level. You can regurgitate. That's the lowest level. Then you memorize. Lowest. If you can create something out of knowledge, that's highest. If you create something that has impact on others, that's even better. But it's not expected PT3 to come out with that kan. So genius lah boleh buat. But as long as that is aligned, it's okay. You want to abolish any exams, fine. Students will not study. They will still study because there are different methods of assessments. Okay, so that's my answer to your question. Hopefully that answers your question. Don't worry, the spark, the interest, different things. Sometimes people get this interest because of too many exams. Okay, brother, proceed.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Tijiri bin Sabli from medical course. So I have a question regarding about ethical boundaries in STEM. So as scientific research, which is boundaries, such as in genetic modification and AI, based on professor opinions and experiences, where should we draw the line? Should scientific advancement always be pursued, or it should be, are there certain areas that should remain off limits, even at the cost of potential knowledge?
Okay. Very good question. Go back to the fundamentals of Islamization of knowledge. Okay. For example, the ethics committee always established in any research. When you propose your research, you have to go through ethics committee first, whether it's human ethics or animal ethics. Both. Yeah, that's the way that research is done for the pursuit of knowledge. So the ethics committee will deliberate and then determine whether there's any limitation or any cut-off point. Can you do this research or has it gone encroached to the limit of being unethical? Once it goes to beyond the limit of ethics, then it cannot be pursued. By right, it should not be pursued. Of course, some unethical experiments occurred. Yeah, we can look back at during the Nazi period when they used human beings in the concentration camps as human trial subjects and whatnot. So until the Helsinki Declaration came about, we talk about the limitations of experiments in humans and so on and so forth. So for us, Islamization of ethics lah. Where in the Quran talk about the boundary? What can you change? What can't you change? Yeah, a simple question I can throw back to you. Can we determine the sex of our offspring? Does Islam allow that? Okay, that's a simple question. So it's done, it's practiced. Okay, can we, like what the brother said, change certain genetic makeup so we can produce super babies? Yeah, brilliant babies, that resilient babies, whatever offspring, or we can alter our genes now in order to help manage certain diseases. If you're afflicted with genetic related diseases, can we then use certain genetic modification procedure so that you, if not reverse the disease, manage the disease? Cure ultimately Allah Subhanahu Wa Taala's domain, but we ikhtiar. Yeah, so maybe that one is allowed. You alter the gene that cause the disease to flare or to be active. So you want to shut down that gene. Can ethics approve? Because studies conducted from that. But studies to produce superhuman beings is not ethical. It will not be approved. That will be maybe explicitly done in certain countries. We don't know. But always go back to the maqasid syariah, fundamentals of syariah, the law, the preservation of life. Would this preserve life or not? If it preserves life, but does it preserve? Of course, the ultimate is the deen, the religion, right? Does it preserve the religion? How does what determines the religion? Quran and Hadith. Okay, if it's not in the Quran, then you have to look at the Hadith. If not in the Hadith, you have to go to the group of people who can produce the fatwa, the decree on this. In Malaysia, we have the National Decree Council, the Majlis Muzakarah Fatwa Kebangsaan. Don't think the Majlis Fatwa Kebangsaan is not STEM. It's highly STEM because they deal with many ethical issues. Yeah? And they have to incorporate scientists. They have to incorporate healthcare professionals. Simple fatwa that I can share with you. What is the fatwa on using the asthmatic inhaler during fasting? Does it invalidate fasting or does not? If you say does not, on what evidence is this fatwa based on? It goes into the wronger. Some medications are used for darurat, emergency. But you have to understand, for inhalers, for example, for asthmatics, there are two types. One, the fast relievers, the rapid relievers, and the other one is the controllers, the preventers. So it means that during the daytime, cannot take at night after breaking of fast only. So, what if you take the relievers, you say it doesn't invalidate. The 10 people would explain to you the quantity of moisture in each spray that goes into the airways and how much is absorbed into the respiratory system. To that point, because in order to come up with a fatwa, you have to look at all angles. So imagine the brother said to do AI, cell engineering, genetic engineering, you need geneticists, you need, I don't know, AI expert of so many people in that group, and then the fatwa will come out accordingly. So whatever you say, where's the line? If it's not clear in the Quran or the Hadith, you need evidence. The evidence that we go by in Malaysia is from the Majlis Fatwa. Like somebody asked me, what's the fatwa on vaping? I said, the fatwa is haram. When did it come out? 2015. What's the fatwa on smoking? Also haram. When did it come out? 1995. On what evidence do they base it? On the fact that it is causing more harm than good. Harm to individuals, harm to others, wastage of money, so on and so forth. So it has to be evidence-based. Any other question? Yes.
Assalamualaikum, Prof. My name is Muhammad Zakwan bin Muhammad TV, and I am from pharmacy course. As my friend mentioned earlier, we will be facing our final exam next week, and a few weeks later we will begin semester 2. Do you have any advice on spiritual, emotional, or physical preparation we should undertake to ensure we can perform our best without becoming exhausted?
Okay. The question talks about the holistic individual here. Of course, we have to properly plan to study everything according to the timetable. Don't make my mistake, so and so forth. But at the same time, make sure that you are always constantly performing your spiritual duties, your religious duties, and maybe perform more sunnah, amalan sunnah at this juncture, because the ultimate number is Allah Subhanahu wa Taala, and the best time that you're going to seek Allah's attention is through tahajjud. Yeah? And if you can perform sunnah fasting is also good, yeah, at your ability lah, yeah. And then do good deeds, mostly do good deeds. Whatever you can, as small as removing the nails or the branch from the root. Do any good deeds that you can. But keep yourself healthy. That means eating, that means sleeping, that means riadah, that's ibadah, everything. Just do. Just schedule time for it. Inshallah, you will see that there are so many methods of studying. So you have to find the methods that suitable to you. Yeah. Some people, they like individual studying with long duration. Some people cannot cope with that. They have to, okay, they're still individual, but they have to take short breaks. So during the short break, you perform Salat Sunnah, or do you read the Quran, whatever. Yeah? And then you maybe do a little bit of exercise, stretching, walking, and whatnot. At the same time, keep on reciting the zikir, so that you always be in remembrance of Allah. And then you will always also keep in touch with your parents if you have still your parents. Ask them to make dua for you. There's no hijab from your mom, so make sure your mom makes dua, yeah, for you. And seek forgiveness from your colleagues, your friends, your teachers. Ask them to make all the ilmu halal for you. Yeah. Basically, do all the good things. Very easy. If you can perform sedekah, do sedekah, even as small as whatever. Can be not monetary, but smile. Yeah, this sedekah. Yeah. Right. Do all this, inshallah, you will be fine through whatever test, trial, tribulations. Easier said than done.
Alright, so thank you very much, Professor, for answering all those questions, and also thank you very much for all the participants that have asked brilliant questions actually. So thank you very much. So since we are running out of time right now, we have to conclude our discussion and conversation here. Thank you very much, Professor, for giving us valuable insights, knowledge, and your words. May Allah subhanahu wa ta'ala grant you His blessings and grant you all the good things in the world, and also bless you in the future. So that is all from me. I will pass the floor to the MC. Thank you very much.
Thank you, Professor Haniki, for a beautiful and insightful sharing. Next, I would like to call upon Madam Diana, the advisor of Medcy Society, to give a token of appreciation to Professor Haniki for being able to be with us today. Alright, before we wrap up, I have something exciting to share. On the 30th of November, we are going to be hosting a fantastic mini science exhibition in collaboration with engineers. It's going to be filled with fun experiments, interactive displays, and amazing discoveries. So, I would like to advise you to mark your calendars and don't forget to come to our exhibition that might be going to be held in the Kawarizmi Hall. And also, please also tell your friends about this news so that with more attendees that can come to our mini exhibition on the 30th of November. So that signifies the end of our program. On behalf of the organizing committee, we would like to take this opportunity to convey our deepest appreciation and gratitude to our distinguished guests for gracing our podcast today. We would also like to thank all parties involved for making this event a success, and we apologize for any shortcomings along the way. Last but not least, before we end, I would like to invite you guys for a photography session. So I would like to invite Professor Haniki and also our Madam Diana to continue our photography session.
QR mana ya? QR mana? Nak live kat QR. Dia letak je. Tak balik. Cek. Pasang. 12. Pasang lah tu. Belakang kan? Boleh je. QR. Star point.
Boleh zoom lagi?
Star point guys. Bagis. Oh ya ke? Dah ke? Tak apa lah. Saya
Boleh ke depan?
Oh iyalah.
Yang pasti tu boleh ke depan. Fotografi ni kena gambar.
dah habis. Ada live, bye.
Start point. Siapa nak start point? Jangan share. Siapa nak start point
Dah
boleh
lah,
tapi
dah.
jangan share.
Kita orang boleh screenshot.
Dah habis. Bye bye korang.